Assalamualaikum students, welcome to lecture 8 on hospital pharmacy. I'm your course instructor Dr. Shabnam Nazir, and today's topic is TPN or hyperalimentation. It is continuation of the previous chapter which we discussed last, aseptic dispensing, and we were discussing about intravenous admixtures in that. So outline for today's lecture. First of all, we will discuss what is TPN or total parenteral nutrition. What are the various main ingredients of TPN, how these are prepared and dispensed. First of all, what is TPN or hyperalimentation? So hyperalimentation is that intravenous administration in which nutrients are being administered, and this is quite comparable to intravenous administration of intravenous mixtures, but that is used for restoring the electrolytes imbalance or water imbalance inside the body. Now, the use of TPN or hyperalimentation is to restore the nutrients deficiency within the body. So this treatment is basically used in highly emaciated patients or those patients who are unconscious and not able to get fed through enteral feeding. So in those situations, TPN or hyperalimentation can be used in order to fulfill the deficiency of nutrients within the body. And its main purpose within the body is to maintain tissue synthesis, positive nitrogen balance, and anabolism. So various ingredients of TPN. TPN is composed of various ingredients. Ingredients are definitely the various nutritional substances like dextrose, amino acids, lipids, and electrolytes like sodium chloride and magnesium chloride. So TPN preparation. TPN preparation requires certain things in which a trained pharmacist is required. Pharmacist must be trained in various methods of preparation of TPNs and the various equipments which could be used during the process. The pharmacist must be well trained in that. There should be proper documentation. Whatever order is received, the ingredients after checking for the compatibility are recorded in the worksheets. And then even when the ingredients are collected after the proper identification, then after the cross confirmation, the documentation properly is signed by the pharmacist. Then there must be controlled environmental conditions, and sufficient space and appropriate arrangements must be there in order to keep the materials. Even in the laminar flow hoods, there must be proper space, and the materials which have to be added into the TPN should be kept in a proper order so that they do not disrupt the airflow and they can be mixed easily without even doing any mistake of mixing them. Trained staff and documentation is required. So as we just talked that pharmacists must be trained, and they must be trained in the patient-based requirements assessments and in the product used then later on specifically by the patients. So it's not only that they are concerned with the preparation and the equipments used, but they are also responsible for the preparation of TPN in such a way that it is based or according to the needs of the patients. And moreover, these products use is proper and they are being administered properly. To supervise this thing is also the responsibility of that pharmacist. Then the worksheets which are developed, that the information which would be present on those labels include the materials of TPN, patient name, and label details. So the pharmacist must be well trained at preparation methods and the equipments required for this program. Moreover, the pharmacist must be well aware about the compatibility patterns between the various ingredients of a TPN. As we just discussed that there are various nutritional ingredients within a TPN like the dextrose, amino acid, lipids and electrolytes as well. So these ingredients, if not properly mixed in a proper order, might cause compatibility issues. So the ingredients would get destabilized. So this might lead to a deterioration or degradation. Environmental condition, presence of laminar flow hood is extremely important in order to provide the aseptic environment, which is the basic criteria or requirement for um, doing or for the preparation of TPN or hyperalimentation. Sufficient space, and the sufficient space is required in order to accommodate the LFH or laminar flow hood. Then the space is required to accommodate the temperature controlled storage facility, as we know that after preparation of TPNs they must be stored until they are dispensed and administered. So their storage should be under temperature controlled vicinity. So that's why there should be a proper space for this purpose as well. Material storage vicinity, those materials which are added and which are used in the preparation of TPN, definitely they have to be stored somewhere, so there should be proper storage vicinity. There should be arrangement area, means after the identification and collection of the ingredients there should be some proper arrangement area so that these items could be kept properly and observed. Then there is a need for space to accommodate the packaging and labeling area. This is also very important requirement. Be stored in such a way that there is no hurdle in the collection of the materials first of all. Then if for example they are left over, then the leftover materials can be restored easily. There should not be any mischance of mixing the wrong materials together. Storage facility, as we just discussed, that TPNs after preparation are stored properly um, till their dispensing or administration is performed, and the temperature which is used for their storage is 2 to 6 degrees centigrade. What is the main purpose of their storage in at such temperatures? Mainly to protect the ingredients from degradation and microbial contamination. Procedure to prepare TPN or hyperalimentation. There should be a proper manufacturing program which is developed by the joint efforts of production and quality control staff. Production staff will prepare all those methods which are adopted to prepare TPN, while quality control staff will develop those methods which are used for testing these preparations. So whenever the TPN request is received, the requested combination is checked for its feasibility and stability, as there is quite a possibility that the ingredients are not compatible, then their order of mixing must be changed, or might be there is a need for changing the ingredients. Based on the TPN request, information is used to produce dispensing worksheet. We discussed previously that as soon as the request is received, that request with the mentioned ingredients and their quantities is noted in a document or dispensing worksheets, and all the information regarding the ingredients and whatever method is adopted for their preparation is included in that worksheet. Then the next stage is of identification of all the materials and then collecting the materials. And after the collection and identification of the materials, once again the pharmacist will check all the ingredients and then confirm those ingredients suggested or requested by the physician by signing that worksheet. So whenever the TPN is being prepared, a special care must be taken whenever the materials and labels are being handled, that there should not be any intermixing, because this might lead to various health hazards if the wrong material is administered to the wrong patient. And materials arranged in the LFH in a manner so that there is no disruption in the airflow, and placed in an easy to use manner. Now the TPN bags or the packaging is also a very important step. The TPN bags before they are used must be checked for any leaks, spots or particulate material in there. And similarly, the TPNs after their preparation should be checked for the presence of any particulate material with the help of proper limit tests, which are developed and adopted by the quality control department. Labeling is also a very important step to be performed carefully. Label would contain all the information regarding the ingredients which are present in the TPN, along with the other necessary information like their storage temperatures and etc.